What's up, guys? This is Dr. Detweiler with Hybrid Performance Group and Team Elite FTS, and we're going to do a little bit of work today on band distractions, specifically trying to target the lower back and give you guys a couple of examples of how you can utilize a band setup to traction the lower back. So what we have here is a setup utilizing a average band and two strong bands in order to set up kind of a bungee or a sling that we're going to utilize to help try to separate some of the joints of the spine of the lumbar spine. So we can run pretty much anywhere throughout the spine. Usually you want to stay somewhere in the lower T-spine and then working your way down into your lower back and the sacral area. But this is going to be a really quick, easy setup you guys can use on your own to get some light distraction, some light recovery work on the spine. So as you can see, we kind of started out, we looped the average band first over the top of the rack, and now we looped the two strong bands together to create two different points in which we're going to attach to the lower back and to the hips in order to try to get that distraction. So this is going to be a great way to get light distraction on the lower back. And the biggest thing that we need to understand about distraction and traction on the lower back is, it really gives us an opportunity to open up the joint and to be able to decrease or even get into a negative pressure at that local disc space. And what that's really allowing us to do is basically allow fluid and nutrients to be able to diffuse from outside of that disc space inside and basically clear out debris and add new cells and new nutrients into that area. So your discs are going to work based on a process called imbibition, in which movement and the flow of pumping of that disc is what's actually going to get fluid exchange in and out of that disc. So basically we're just utilizing the bands to try to get a similar situation going on. This is also really good for those of you that are loading the spine heavily, and it allows us to give us a situation in which we can decompress the spine and allow some of that recovery work to add up a little bit on the lines of actually having time that we're not basically compressing ourselves. Even when we're not necessarily loading our spine with weight, what we are going to have is just simply the body weight that we are carrying around that is going to compress the disc. So there are very few situations in which we are actually completely decompressed and allow that process to basically open up that lower back. So we're going to show you how to go ahead and do that. So what you're going to do is you're basically going to throw the band over the top, right? You're going to set up that sling. So I'm going to want one of these bands to be underneath and one of these bands to be over the top. So I'm going to want the lower band here, right? It's going to be set right around my pelvis or L5 region, and then I'm going to lay the second band a little higher, right? So now I'm going to start getting a little bit of traction by sitting back, right? If I need to, I can reset that band any way I'd like. And as I set back, even just in this position, I can start using the band just to press, and you can actually start to feel how that traction is already starting on the lower back. Again, this is not going to be a heavy traction. That's not what we're looking for. Even in clinical situations, when I'm maybe utilizing an actual traction unit, we typically don't get very far past even like 100 pounds worth of traction. So we're not looking to utilize like our whole body weight to pull the spine apart or anything like that. This is, again, just light traction. So these bands should stick pretty decently here. And what I'm going to do is I'm going to sit back, right? And as I sit back, I might even hinge a little bit. So I might push that butt back and hinge. And you'll feel basically what's happening is you have one band that's going to be here that's going to be pulling down a little bit, and the other band is going to be pulling up a little bit. So as I sit back and hinge and even just round a little bit, you're basically getting that distraction at the local level, and I can feel that distracting at that point. Again, you can add to that by pressing into here on the front of the band, which is essentially just going to pull those bands apart a little more. So again, we're just lightly tractioning this area. I'm not trying to do anything too crazy. From this position, once you get into a comfortable position, you can even do something like hinging back into a lunge to get just a little bit different of an angle. There's plenty of variations you can do. You can even rotate, right? So allowing your upper body to stay where it's at, rotating the lower body. Again, your real only limitation here is just to make sure you're not forcing yourself through a range of motion you don't need to be in, and just gradually work that range of motion. All right. So the second portion of this band setup is now I can use both bands together, and I can walk back to a very specific spot. And what that's going to do is it's going to target the specific area in my spine that the segments that the band is going to be attached around. It's going to target those segments. It's going to allow me to just milk and floss those segments alone. So again, same setup. I'm sitting back a little further, and now I'm just pushing down, and I'm feeling a little bit of that distraction just from that extra little push. Okay. Now, depending on how healthy your spine is, you might feel this a little more, and you might feel this a little less. So again, these are just guidelines for you to start to go into a position that you can then find what best relieves tension or gets kind of that stretching, that distraction that you're looking for. Again, these are very safe, very simple ways to accomplish that. And again, like you're seeing, we're not necessarily flipping you upside down and going from a position where maybe you're 300 and some pounds, and you're going from a position where all that load is on your back, and then you're going into a position where you're upside down, and now you're actually in a negative pressure. In those situations, it's not necessarily bad, but what happens, you got to be really careful of. If you're someone that has lower back issues, or if you have some lower back pain, and you end up utilizing this distraction, or if you have a history of lower back pain, if you start utilizing this distraction mechanism, or utilize any other mechanisms in which you start really getting into a high amount of pulling that's going on, or high level of distraction, you have to consider the thought process that you're going from a loaded position to essentially a negative pressure on those discs, and you have to be careful on how you reload the spine once you're getting out of that position, because a lot of people are sometimes using this for 10, 15, 20 minutes of distraction, and we have to make sure that we reintroduce that load to the spine correctly in order to keep it from having a situation where it might spasm, or you might have a little bit of a relapse of that back pain because of it. So again, recommendations on this is just to kind of get into that bungee position, or stack those bands on top of each other, and just get into that position for a good 5 minutes, maybe 10 minutes, and just kind of milk through these positions. So play around, try a couple different variations, but again, the whole purpose is we're just trying to get light traction on the spine, and essentially get it into a position where we're spending a lot of time loading it. Let's give it a little bit of love and make sure that we're spending some time at least distracting and getting some fluid pushed into those joints so we can help that recovery process.